Okay, so now that we know how to log in and get to the nursing note, we're going to go ahead and just fill one out so you guys know how to do that. So go ahead and make sure that the iPad's in the horizontal position, and then let's maximize this to make it a little bit easier. All right, here. So at the top you'll see client, and then also the care period is noted. Visit details section, that just is going to have the date and time of the visit. Please make sure you're documenting on the right date. You can see the patient's primary diagnosis here as well as secondary. This is just a test patient, so we have entered neurogenic bowel as one of the primary diagnoses. One of the important things of filling out the note is just to make sure that every single section has something documented in it. So we'll start with vital signs. Vitals should be taken according to your plan of care or orders. Generally that's going to be once a shift or twice a shift or once a visit. So please make sure you document the full set of vitals. If the patient does refuse or decline, that's fine, but under comments make sure you type in patient refused. The next section is skin. At the top there you'll see add wound care flow sheet. We're going to go into that in another video. That is where you will be documenting if the patient has any wounds. So we'll get back to that. So for now, and once again, we're just making this assessment up, but we'll just say this patient skin is pink and within normal limits, no wounds noted. Pain profile, we're going to document obviously if the patient is in any pain. Please make sure you're actually asking the patients. Sometimes we get notes back, and I know this patient is in pain. When I visit him, he's always telling me how he's in pain. So please make sure you actually are documenting what the patient states, because a lot of times nurses will say, no, this patient's not in any pain, when I know for a fact that he is. So we'll say this patient has a 5 out of 10 pain. Description, aching, just follow the cues. Duration, intermittent. Primary site, we'll just say right hip. Frequency of pain interfering with client's activities or movement. We'll say less often than daily. Current pain management. Effectiveness, effective. And then in comments, let's just say what we are doing to help the patient with pain. Provided patient with analgesics. Okay, now we're going to go to respiratory. So for our respiratory assessments, just to make this interesting, we're going to say our patient is trach vent. So we'll do breath sounds, do clear within normal limits, bilaterally. Patient is not short of breath. We can say cough. We will do other, and then down in the comments we'll type something in there. O2, we'll say this patient is on 2 liters per minute, so liters per minute is the next one down, so liters per minute via trach. Frequency, we'll say continuous, and then since he or she is on oxygen, make sure you click O2 precautions. Okay, so down in the comments is where we're going to be a little more specific. So the patient is, let's say, has a Trilogy 100 vent. We'll say the trach type and size, so we'll say Bavona, number 7, with, we'll say 3 to 10 milliliters of sterile water in cuff as needed. We also need to make sure that we're documenting, let's see here, when the trach was last changed. We'll say the trach was last changed July 1st, 2018. I'm just referring to my notes to make sure I don't miss anything here. Oh, and then also, if the patient is on a vent, you're going to be documenting in the vent flow sheets. We'll get to that a little bit later. But for now, we're going to say vent checks done Q4 hours / as needed. Okay, so that's the respiratory. Go down to cardiovascular here. We'll say this patient is within normal limits for cardiovascular. I always make sure to document patients' radial and pedal pulses. It is up to you. I just think it's good practice. You can also see, we'll just go through all of them here so you guys can see what they are. So heart rhythm, make sure you document if the patient's tachycardic or bradycardic. Edema, if the patient does have edema, what type it is and the location. Cap refill, less than 3 seconds or greater than 3 seconds. Heart sounds, just a faint, regular murmur. Okay, let's go down to the next section, neurological. We will say this patient is a quadriplegic. On the left here, level of consciousness, we'll say this patient is alert to person, place, and time. Vision, wears corrective lenses. And then, like I said, each patient's different. You're just going to have to go through, when you're with a nurse that you're training with, kind of see how they document specifically for that patient. But yeah, you can go through all of these at that time and see, you know, are there other drop-down boxes when I click that. Next up is musculoskeletal. We do have quite a few spinal cord injury patients, and a lot of times we notice that newer nurses get used to the habit of just clicking within normal limits. Please make sure if your patient does have some sort of injury or disease process that affects their musculoskeletal system, that you are not clicking on within normal limits. So for here, we'll say mobility. This patient is non-ambulatory. Impaired motor skill is going to be gross. Type of assistive device, so we'll say he uses a wheelchair. And like I said, it's just all patient specific. Grip strength, you can go weak bilaterally. If they have limited range of motion, document that and where. Say bilateral, lower extremities. Okay, next up is gastrointestinal. One of the things that I want to make sure you guys are always documenting is the last bowel movement. If you weren't there and you're not sure, you know, if it was abnormal or constipation or diarrhea, that's fine, but please make sure you're documenting what the date was. So today's the 10th. We'll say the nurse reported to me that he had a bowel movement yesterday. Also, it's worth noting in here, for instance, this patient requires a bowel program, we'll say, because as you remember, their diagnosis was neurogenic bowel up at the top here, and their primary diagnosis. So therefore, their gastrointestinal is not within normal limits, so you can put down here in the comments, patient requires bowel program due to neurogenic bowel. That's just another thing that we've noticed. Some of the nurses are documenting within normal limits, even though the patient does require a bowel program in order to remain continent. The next section is nutrition. We'll just say, let's say this patient has enteral feeding through a PEG tube. We can go diet type. We can say it's Nutrin. Their diet's adequate. If you've noticed they've gained or lost a lot of weight, go ahead and document that. Let's see here. Make sure you're documenting your residuals in this section. And then also in nutrition, let's say this patient has continuous tube feedings or it's running through a pump. So we can say Nutrin running at 75 milliliters per hour via kangaroo pump. So the comments is kind of where we just add the specifics. The next section is genitourinary. So we'll say that this patient receives straight caths. So under comments, we'll put patient straight catheterized Q4 hours /PRN. Now you can document, it's up to the patient, it's patient specific. Some patients require us to document in the INO, some do not. If your case does not require you to document in the INO, please make sure you are documenting the volumes of the straight cath here. So we'll say 0800 straight cath. We'll say 400 milliliters of light yellow urine. And then so on and so forth. You would do 12 and document the volumes there. If they do require, if we do require you to document in the INO, I'll go over that at another time. Let's go back up here though to the top of genitourinary. So if they are incontinent, make sure you're documenting that. Let's see here. Oh, catheter and device. If your patient has a suprapubic catheter, or a Foley catheter, condom catheter, whatever type of catheter it is, make sure you're documenting on it. I know we said we straight cath this patient, but just for example, we'll say this patient has a suprapubic catheter, and then also make sure you're documenting when it was last changed. So we'll say this one was last changed in August. We'll say it was August 6th. And then document the size and then also the amount of water that you're putting into the balloon. Okay, next up is diabetic care. We'll say that we are checking this patient's blood sugar, and we'll say we got a reading of 100. Now, it could be random or fasting. Fasting is if the patient has not eaten or drank anything at least 8 hours prior. So generally, fasting is going to be your AM blood sugar. So we'll say AM. Performed by skilled nurse, site. We'll say second digit on the right hand. Diabetic management. So the patient is on an 88 diet. He is taking an oral hypoglycemic. If he is taking insulin, we would click insulin there. Just follow the cues. As you can see, insulin administered by whoever that was. If the patient does have any signs and symptoms of hyperglycemia, make sure you're documenting these. If you're documenting these, I'm hoping you're calling the doctor as well. Signs and symptoms of hypoglycemia. But if you're needing to document these, then we need to look into what's really going on a little bit more. Okay, we'll go back up here. IV, generally our patients are not going to have any IV access. Sometimes they might come home from a hospital and require IV antibiotics. That would be the case. If so, just make sure you document what type of line it is and the location of it, condition. All of that will need to be documented. If it was flushed. But generally, most of you watching this video are going to be clicking not applicable for that. Okay, infection control. Add infection log, that's another one we're going to get to in another video. You'll need to document anytime the patient has an infection or is put on an antibiotic, but we'll go over that a little bit more. You're always going to make sure that you're clicking universal precautions observed, as well as Sharps waste disposal. Even if the patient doesn't have sharps, note that it says waste disposal, so you should be properly disposing of the waste in the garbage can. Okay, care coordination. Anytime you talk to a doctor or anyone involving the care, make sure you're putting it here. At minimum, you should be doing care coordination with the skilled nurse that you're giving a report to. So we can say report given to whatever the nurse's name is at end of shift. Okay, care plan. Only the clinical managers will be changing the care plan, so you're just going to go ahead and document no changes at this time. Progress towards goals. However you feel they're progressing, generally it's going to be good or fair. New changes, orders, or updates to care plan. No. Okay. Also note that there's add new order here and add incident log. These are other things that we're going to be going in other videos as well, but do note that you can find add new order under the care plan section. Discharge planning. You will not be discharging any patients. That's something else that the clinical managers will be doing, so go ahead and just select no. Okay, interventions. This is the section where you're going to get credit for, all the skills and interventions that you've done with the patient. So make sure you do get credit for those and click on the ones that you're doing. Generally, at minimum, you're always going to be doing a skilled observation or assessment. I like to type in head to toe. With this patient, we did diabetic monitoring and care. We can say client caregiver teaching. You're probably doing a lot more teaching than you think. For instance, we could say instructed the importance of maintaining diabetic diet. We administered enteral nutrition. You don't have to type in the instructions here if you don't want to. We did that up there in nutrition already. Let's see here. If you did any instruction on medication, go ahead and do that. So anything and everything that you did, make sure you're clicking. Medication administration, again, you don't need to click instructions. You more than likely did PEG tube site care. You more than likely did trach care for this patient. Oh, there actually is a diet teaching there, so we could have put that in there as well, what I put under client caregiver teaching. Okay, the next section is narrative and teaching. You've been provided a sample narrative. There's a couple ways of doing it, but basically this is just going to paint a picture of what the shift looked like. I'm not going to type one now, but go ahead and look at the example. You can do it hourly, or you can also do it in narrative form. That's up to you. Next section is response to teaching / interventions. So you can say that the patient verbalized understanding of the verbal instructions or teachings given. The one that I generally click is treatment or procedure well tolerated by patient. If the patient is on an antibiotic, then we can say infusion well tolerated by client. Go to the next section, homebound status. All of our patients should have a homebound status, otherwise they would not be receiving private duty nursing or home health care. So we'll say this patient is unable to safely leave home unassisted and requires assistance of another to get up and move safely. Phlebotomy is generally always going to be not applicable. Okay, and then that brings us to the bottom. If you look down at the bottom under addendum, I'm going to go over these in the next video. But in order to sign your note when you're done, your signature is going to be the password that you use to log into Axxess. And then just make sure that the date coincides with your with the date of make sure the date coincides with the date that you went there. Thank you.